Welcome to RPNIO's Self-Care Series. This is Module 3 of Mental Well-Being. This module is focused on resilience. Our agenda today will include a discussion on resilience in understanding what is resilience, where is resilience sourced from, the importance of building resilience, effects of the nursing environment, and resilience in nursing students. In addition, we will discuss working on resilience in understanding how to build resilience and finding the right strategies. Resilience. Resiliency is your ability to cope successfully, even though there may be adverse circumstances in one's life. A person is able to recover easily despite setbacks occurring. Resilience can also be known as inner strength in oneself. It helps an individual recover in a stressful situation. When an individual is resilient, one has the ability to recover at a greater rate from setbacks or changes in life. Resilience is not the ability to find a stressful situation easy to deal with, or the ability not to feel anger or sadness during a difficult time. Simply, it assists an individual in not feeling as overwhelmed in a given situation. The resilient individual has greater success at coping with a situation in a healthy way and less likely to give up on the provided situation. Resilience is able to aid nurses in addressing burnout from workload-related factors. RPNs were able to identify factors that led to increased workloads and identified it as extra tasks that appeared throughout the workday. That being said, having excessive workloads can lead an individual to suffer from stress and burnout. And as a result, it's recommended that by using a resilience-based approach in nursing, it will assist nurses in addressing burnout and also assist in reducing turnover rates. There are various sources of resilience and can include personal factors. There are various personal factors that can contribute to one's degree of resilience. They include personality traits. One who has openness, self-esteem, and positive interpretation of events contributes to the greater degree of resilience. Demographics, age, gender, race, ethnicity, all can contribute to one's degree of resilience. Also, biological factors. There are various biological factors that can contribute to the degree of resilience, including early childhood environment, as this can affect a brain that's developing in its structure and function. From this, it can affect the brain's ability to be able to monitor negative emotions, contributing to resilience. In addition, there are also environmental systemic factors that contribute to one's degree of resilience. They include your own social support system. This can include support from positive peers, teachers who support you, and immediate family members. It can also include one's own community factors, such as a good education system, having community services available, opportunities to engage in sports or artistic activities, and less exposure to violence, all contributing to one's degree of resilience. As a result, when there is a healthy nursing work environment that encompasses these characteristics, it can promote nursing resiliency in addition to nurses' satisfaction with his or her job. Resilience is vital in both nursing students and their respective nurse educators. This is important when facing adverse challenges. For example, nursing students demonstrated resilience through showing perseverance through challenges, leading to success and completion of their education. In addition, resilience is a factor of optimism in educators. The more optimistic an educator is, the more resilient they are in coping with challenges in the workplace. Resilience has also been shown to be a large factor in a nursing student's ability to be assertive when dealing with aggression in the clinical placement setting. Finally, the relationship that forms between nursing students and teachers is vital. A teacher who is more engaged and connected with his or her students contributes to a student's ability to develop a form of professional resilience. Educators also noted that when students were more resilient, it impacted their choice of remaining in an educational program. Working on resilience. There are various ways one can build resilience. Creating connections, which includes having good relationships with family, friends, or those close to you, and accepting help from these individuals who can listen to you. Attempt to not see a crisis as impossible to overcome. This involves recognizing that you cannot always prevent a stressful event from occurring. However, you can change how you may respond to the event that has occurred. Accepting change as part of a life. This involves accepting that a goal may no longer be attainable due to adverse situations occurring. This allows you to accept that some aspects cannot be changed and helps you to focus on what you can change. Working on your goals. Create realistic goals that you can accomplish. With that, try doing something regularly that can help you to work towards the goal you created. By removing your focus on a specific task that may seem unachievable and focusing on questioning yourself on what you can achieve today, goals are more achievable. Find opportunities in self-discovery. This involves the ability to learn more about yourself as a result of a struggle or loss. If you are able to grow from the situation, it allows you to have a greater appreciation for life, even in times of vulnerability. Keep events in perspective. This involves looking at a stressful situation from a broader perspective. By refocusing on the long-term perspective of the situation, it prevents you from blowing the immediate stressful situation out of proportion. And be hopeful. This technique involves having an optimistic perspective, which allows an individual to expect good things to come, instead of having constant worries about what is feared, thinking about what you want to achieve instead. Find time to take care of yourself. When you're able to find time to take effective care of yourself, you're able to put your attention towards your own body's feelings or needs. This can include participating in a relaxing activity and exercising. By doing so, you're able to prepare your mind and body in the event that a situation requires you to be resilient. By answering some of these questions, you might be able to find out how you were able to effectively overcome a situation or not overcome a situation.